There are really some amazing cutting-edge techniques that can be implemented to treat these children. And I know, for instance, one of my colleagues, Dr. Nick Nguyen at Aliso Shore Dentistry, he has provided treatment through what we call orthotropics. So these devices take advantage of the natural growth of the craniofacial skeletal structure to not only optimize the aesthetics of the face, but more importantly, to optimize the airway anatomy and thus the breathing and the sleep quality at night.
I have seen actually some of my patients still who do have tooth extraction, and we're talking about extraction of permanent teeth. It's hard for me to see those patients because my personal feeling is that there is probably almost no reason to take out permanent teeth. That if the jaw is so crowded that there's not enough room for all the teeth, then that means the jaw needs to grow larger, and not that we need to take out teeth so that we can accommodate a small jaw.
From my history is that my family dentist growing up just ended up pulling out teeth. And we didn't kind of want that for our kids, and wanted to see if there was something that we could do to sort of mitigate that. You know, our daughter, she had a severe, I guess, underbite or crossbite, I don't know what it's exactly called, but he was able to correct that already within, I want to say, like a month. Our son, I guess he had a lot of crowding, and so far, I guess with Dr. Nick's help, we haven't had to pull any of his teeth, his adult teeth. So it's been wonderful to see, I guess, the progress in terms of, you know, his teeth opening up.
You know, before I brought my child to Nick, you know, I took my child to another pediatric dentist, and it was just standard care. I mean, you know, there's just no focus on, you know, jaw structure, bite, you know, functionality, breathing. I mean, none of those elements were discussed or even brought up or even on their radar. And so it's great to have that knowledge and to kind of be able to bounce it off of somebody and kind of just try to stay ahead of the curve.
I knew of Dr. Nguyen making these oral appliances, and I came here and he fit me, and I love it. It actually works as well or better than my CPAP machine, and it's far more comfortable. I don't have to worry about electricity. I don't have to worry about distilled water, getting it through customs, all that things. I just have this thing I pop in my mouth at nighttime. My apnea is taken care of, and that's important to me because of my health.
Number one is health. We really see an improvement. He's breathing, he doesn't have allergy problems, he runs very well, and also aesthetically he looks great.
The other thing that was quite eye-opening for us was that, you know, that there was this connection between like your teeth and your jaw and your face to, you know, even just how you breathe. And like your breathing and how your breathing and breathing through your nose or through your mouth can affect like your overall health, I think. And that is something, you know, that, you know, we would have never, you know, thought about before. But after coming here, it, you know, it's all perfectly clear, and, you know, we wholeheartedly believe the same thing.
Dr. Ren is very passionate about what he's doing. He just doesn't do it for money or just because to do something and get rid of it. But he's really passionate. He doesn't leave it before he has results.